Namaskar and welcome to this live Facebook session. मैं हूं डॉक्टर किरणजीत सिंह, फिजिशियन, और आज हम लोग चर्चा करेंगे ऑन ब्लड प्रेशर या हाइपरटेंशन जिसको हम कहते हैं। और इस चर्चा के लिए मेरे साथ हैं सीनियर फिजिशियन डॉक्टर सरिता कुलकर्नी और हमारे एक सीनियर कार्डियोलॉजिस्ट डॉक्टर विक्रांत खेसे। वेलकम फॉर दिस सेशन। So, Sarita, we'll start with you. तो what is this blood pressure? जो पेशेंट सब लोग बोलते हैं कि मुझे ब्लड प्रेशर है, तो क्या उसके बारे में आप कुछ कहना चाहेंगे?
ब्लड प्रेशर, हायपरटेन्शन या रक्तदाब, मराठीत ज्याला आपण रक्तदाब म्हणतो, त्याचं प्रत्येकाचंच ब्लड प्रेशर असतं, पण 120/80 म्हणजे वरचं आणि खालचं ब्लड प्रेशर असतं. वरचं नॉर्मली 120, खालचं 80. 120/80 is considered as normal blood pressure. Anybody who has a blood pressure above that, so 120 to 130, that is considered as high normal. More than 130/80 is considered as hypertension or high blood pressure. So there are stages. More than 130/80 is high blood pressure stage 1, and more than 140/90 is high blood pressure stage 2, and that requires attention and treatment.
Very nice input you have given as to the numbers what we should be looking forward to. डॉक्टर कैसे आप देखोगे हमारी प्रैक्टिस में अक्सर पेशेंट आते हैं, वो डिनाइल में रहते हैं। उनको जब हम कहते हैं कि आपका ब्लड प्रेशर इतना है, तो बोलते हैं मेरा इतना ही रहता है। तो उसके बारे में आप क्या कहना चाहेंगे? और एज अ कार्डियोलॉजिस्ट आपकी क्या चिंता रहती है कि कोई पेशेंट है वो हमेशा बोलता सर मेरा प्रेशर हमेशा ही 150/90 रहता है, तो उस प्रकार के पेशेंट से आप क्या कहना चाहेंगे?
कैसा है, हाइपरटेंशन एक ऐसी बीमारी है जिसमें 90% ऑफ द टाइम्स पेशेंट को कोई तकलीफ नहीं होती, और पेशेंट का बीपी 200 भी हो तो उसको पता भी नहीं चलेगा कि वो 200 चल रहा है। इसीलिए उसको चेक करना जरूरी है। जैसे मैडम ने कहा कि इट इज़ वेरी इंपॉर्टेंट टू चेक एंड देन नो इट। विदाउट चेकिंग इट इज 90% ऑफ द टाइम्स पेशेंट विल नॉट नो। सो ऐसे पेशेंट्स में हमको रिपीटेडली मॉनिटर करना चाहिए। और ये जो ब्लड प्रेशर है जब ऐसे हाई रहता है लंबे समय तक, कुछ समय से, तो वो ब्रेन, हार्ट, किडनीज ऐसे ऑर्गन्स को डैमेज करता है। इसीलिए हमको इसको चेक करके कंट्रोल में रखना जरूरी है।
If I can not sum it up, but if I can say concisely, इस बीमारी को हम लोग साइलेंट डिजीज और आई डेयर से साइलेंट किलर भी कहते हैं। क्यों? क्योंकि धीरे धीरे जो रक्त का ताप है, जो उसका जो प्रेशर है जो आपके वेसल्स में है, वो वेसल्स में डैमेज करता है, और उसके कारण हमको हार्ट अटैक, स्ट्रोक वगैरह कई बीमारियां, बट मोस्टली ऐसी बीमारियां होती हैं। और जब होता है तो हमेशा फिर एक कोई बड़ा काम ही होता है। तो मैं हमेशा ये, क्योंकि हमारे पेशेंट यहाँ पुणे में मोस्टली इंजीनियरिंग बैकग्राउंड के होते हैं जो मैं देखता हूँ, तो द एग्जाम्पल आई गिव देम इज लाइक इफ इज इन अ फैक्ट्री यू हैव अ पाइपलाइन व्हिच सेज दैट यू कैन हैव 10 kg per square centimeter pressure. So it's okay if you have 12 kg per square centimeter, 14, but over time the fatigue will set in. फिर एक दिन जब वो फटेगा तो कैटास्ट्रॉफ होगा। So this is the example I like to give to the patient, and they do understand when you tell it in those many lines. So Sarita, can you quickly enumerate the various problems which occur in a person if the blood pressure is not controlled over a period of time?
So if the blood pressure remains high or is not controlled over a period of time, the blood vessels supplying different vital organs get affected. The main organs which could get affected are the brain. Brain में ये हो सकता है कि brain, if the pressure is too high and suddenly goes too high, there can be a rupture of the blood vessels, and that can lead to what we call as intracerebral hemorrhage, bleeding in the brain, leading to a stroke. Blood pressure can also lead to changes in the blood vessels of the supplying the brain, leading to a thrombotic stroke. जैसे blood clot बन जाता है, leading decreasing the blood supply to the brain, leading to paralysis or stroke. Secondly, kidneys can get affected over a period of time. जो high blood pressure रहता है, that damages the blood vessels supplying the kidneys, and slowly the kidney dysfunction can set in. That is the second important organ. Third important and critical organ is the heart. So most of the times high blood pressure patients have also got increased risk of heart attacks or coronary artery disease. Secondly, because of sustained high blood pressure, there is also a risk of cardiac failure, that is heart failure in these patients. Multiple other organs can also get affected, including the eyes, because the small blood vessels, the fragile blood vessels in the retina of the eye, they can also get damaged over a period of time due to high blood pressure. So these are some of the organs which can get affected.
Okay, very nicely brought up. सरिता, मैंने देखा है प्रैक्टिस में कि लोगों का कंसेप्शन है कि ब्लड प्रेशर वाला बीमारी या हाइपरटेंशन 40 साल के बाद ही होता है. So what is your professional input on that?
So previously it was considered that hypertension is only a disease of old people. I can't have hypertension because I'm not yet 60. But it's not so. Now with the lifestyle that we are following currently, blood pressure is coming at a very younger age. We see it mostly in the third decade of life. So it is, and as Dr. Khese pointed out, most of the patients are asymptomatic. They will not have any symptoms. So it is diagnosed only incidentally when the patient goes to a doctor, maybe for some other reason, कुछ viral fever के लिए गए और pressure high diagnose हुआ, then it needs to be followed up. So actually we should start looking for hypertension even in patients as young as 20, 25 up to 30 years of age.
That's a very nicely brought out point. The normal concept है कि 40 के ऊपर है तभी blood pressure होता है. But all over the world the literature says that essential hypertension or primary hypertension, it comes in patients in the third decade of life. It means after the year of 20. It is just a whole lot of us miss it because we are not looking for it. But my message to the viewers would be that when you go to a doctor for whatever reason, please ask the doctor to check your blood pressure. It just takes a minute, no matter how inconvenient it is. Dr. Khese, mostly you're dealing with heart disease. Heart disease में भी bulk of your work will be coronary artery disease, जैसे हम heart attack वाला disease बोलते हैं. तो आपके लिए ब्लड प्रेशर का क्या इम्पोर्टेंस है, और स्पेशली दोज पेशेंट जिनका आप एक बार किसी का एंजियोग्राफी एंजियोप्लास्टी आपने कर दिया, तो उसके बाद ब्लड प्रेशर मेंटेन करना कितना आवश्यक है?
देखो, जो ब्लड प्रेशर है उसको मेंटेन करना जरूरी है, क्योंकि जब ब्लड प्रेशर, जैसे आपने कहा कि ब्लड प्रेशर हाई होने के कारण वो पाइप में प्रेशर ज्यादा हो गया, वो प्रेशर का भी कुछ कैपेसिटी है. वो अगर ज्यादा प्रेशर सस्टेन कर रहा है तो वो जो पाइप है वो कड़क होते जाता है बेसिकली, मतलब उसमें कोलेस्ट्रॉल डिपॉजिट होने लगता है. तो अगर ब्लड प्रेशर कंट्रोल ना करो, ये कोलेस्ट्रॉल डिपॉजिट होने का जो दर है, जो 20 साल 30 साल लगते हैं, जिसको वो 5 साल 2 साल 3 साल में हो जाएगा. इसीलिए जो स्टेंट हम डालते हैं, अगर ब्लड प्रेशर कंट्रोल ना हो तो उस पर कोलेस्ट्रॉल डिपॉजिट बहुत जल्दी हो जाएगा और वो स्टेंट जो डाला है वो जल्दी खराब हो जाएगा. इसलिए बहुत जरूरी है.
So this is very important what he said, and just because people have this thing कि अभी तो मेरा हो गया स्टेंटिंग, आई एम ऑल राइट, नहीं. तो जो जितने उसके रिस्क फैक्टर हैं हार्ट डिजीज के, जिसमें प्रेशर भी एक है, उसको मेंटेन करना जरूरी है. एंड हार्ट एक प्रकार का पंप है, तो अगर पंप का आपको लोड ज्यादा है, उसको अगेंस्ट ज्यादा लोड पंप करना है, तो उसके ऊपर असर आता है.
जैसे हमारा मसल बनता है
वैसे
हार्ट का भी मसल ठीक हो जाता है. जब
हम
और
यहाँ पर आम का मसल बनना अच्छा है, लेकिन हार्ट का मसल बनना अच्छा नहीं है,
क्योंकि उसको ज्यादा काम करना पड़ रहा है
जी
अगेंस्ट हाई प्रेशर.
That's right. Dr. Sarita, will you just quickly tell our audience as to what is the difference between primary and secondary hypertension? Because important people say कि मुझे blood pressure क्यों हुआ?
The most common question which any patient coming to me would ask is why do I have this blood pressure? So commonly the blood pressure which is diagnosed at say 50-60 years of age, it is called as primary or essential hypertension. So there is no, there are a lot of pathophysiological causes for it and mechanisms for it, but there is no specific organ related cause, and there is something called as secondary hypertension which occurs secondary to some other things. Like for example, people who are having issues with their adrenal gland, there is a condition called pheochromocytoma in which we will get secondary hypertension. Some people have kidney disease at a very young age, or some people have disease of the blood vessels affecting the kidney, supplying the kidney. This is called as renovascular hypertension. These are some of the secondary causes of hypertension.
So very nicely brought out.
Importantly, there is also hypertension related to consumption of certain drugs. Some people may be using oral contraceptive pills, some people may be using over-the-counter analgesics or abusing analgesics. एक बार डॉक्टर ने दे दिया analgesic, पेन किलर किसी चीज के लिए, तो वो लेते रहते हैं. All these things can also lead to secondary hypertension.
Okay, so secondary hypertension, what I understand is 90 to 95% of the people who have blood pressure उसके उनमें कोई आइडेंटिफाइबल दूसरी बीमारी नहीं होती जिसके कारण ब्लड प्रेशर बढ़ा है। हाँ, ब्लड प्रेशर बढ़ने के कारण कुछ उनके ऑर्गन में अफेक्ट आ सकता है, तो इसको बोलते हैं प्राइमरी हाइपरटेंशन। तो जो बीमारियां और कोई 10 to 5% पेशेंट्स में द ब्लड प्रेशर इज बिकॉज कोई और बीमारी शरीर में पनप रही है, तो उसकी सूची लंबी है। लेकिन द कॉमन थिंग इज व्हाट यू ब्रॉट आउट, किडनी और किडनीज ब्लड सप्लाई, and thyroid is another issue. So both hyperthyroid as well as hypothyroid. So I make it a point to person I'm diagnosing blood pressure for the first time that we also always look for thyroid. And FIO you brought out, yes, it is rare but not unknown. But of course one doesn't test for that immediately, but there will be indications for that. तो डॉक्टर सरिता, अगर कोई पेशेंट आपके ब्लड प्रेशर का आता है, फर्स्ट टाइम आपने उसका किया, तो उसको क्या टेस्ट आप बोलते हैं करने के लिए?
So basically, the test which I would ask a patient to do, I would ask them for two reasons. One is to see the associated problems with blood pressure, because blood pressure is very commonly associated with diabetes, very commonly associated with high cholesterol. So there would be normal blood tests, including cholesterol tests, including kidney function tests, because the kidney function test would also help me to decide which tablets to use in a particular patient. And second category of test that I would do is to look for end organ complications. जैसे हमने बोला है कि heart can get affected, kidneys can get affected, the eyes can get affected. So I would ask for a ECG, I would ask for 2D echo to look for the thickness of the heart muscle. I would also ask for a retinal examination by an ophthalmologist to see if the blood vessels of the eye are thickened or they have been affected by blood pressure.
Very nice, because the eye is like a window from where you can see the blood vessels, right? डॉक्टर खेसे, मैडम ने बोला कि फॉर टारगेट ऑर्गन डैमेज स्पेशली हार्ट इज अ वेरी इंपॉर्टेंट वन, सो शी लाइक टू डू एन ECG, a resting ECG and a 2D echo. And these patients I also like to do a treadmill test. So, but if the blood pressure is high, so what is your, I mean, immediately of course I will not ask the patient to do a treadmill test. So what is your take on it, when the treadmill test should be done and should it be done or not done?
सो जैसे ब्लड प्रेशर के साथ हार्ट का जो ब्लॉकेजेस है वो भी बहुत कॉमन है, इसलिए ट्रीटमेंट टेस्ट शुड बी डन एब्सोल्युटली। लेकिन जब ब्लड प्रेशर अगर बहुत ज्यादा है तो उसको हम स्टेबलाइज करके नॉर्मल, क्योंकि जो हमने देखा है वो रेस्टिंग में है, वो जब चलेगा तो और बढ़ेगा। ये तो रेस्टिंग स्टेट में भी बढ़ा है तो फिर वो और बढ़ने का पॉसिबिलिटी है, इसीलिए वी वेट, control it, and then we do it.
So that is exactly what I do.
Yes.
Firstly, I tell the patient, right now I'm only asking you for ECG and a 2D echo. However, once your BP is better and you are this thing, then it's probably safer to put you on a treadmill test.
Yes.
और ये बोलते फिर हाँ, चलो we'll come to another part. So Sarita, what are the do we start giving medicines to the patient who comes first time when you detect blood pressure, or what prompts you to start blood pressure medicines?
So basically, any patient who walks into our OPD, and most of the times, as we have previously discussed, the patients don't have any symptoms related to blood pressure. So it is incidentally diagnosed when they come for some other reason, or they may be coming for some very non-specific complaint, sometimes headache or some tingling sensation, and we find that the BP is high. First time that we see the blood pressure is high, we don't immediately put them on medications, because these medications need to be given fairly on a long-term basis. So what I would like to do is I ask the patient to first take at least 3 to 4 blood pressure readings on 3 to 4 separate occasions when the patient is adequately rested. These blood pressure readings, there's something called as white coat hypertension, because when a patient walks into a doctor's cabin, he naturally gets anxious and the BP could be high. So we ask the patient to go home, take rest, and check the blood pressure in their familiar surroundings on 3 to 4 occasions. If all these readings are high, then definitely the patient needs to go on BP medications.
No, but let's say it is like 140/90. Would you like to start and it has happened over 3-4 readings. So we establish कि ये patient को blood pressure है, अभी 140/90 वाला तो pressure है, या जो नए आपने figures बताए हैं उसके हिसाब से 130/90 है। तो ऐसे patient को क्या हमको immediately medicine start करनी चाहिए, or because patients are always reluctant and there's so much of information on the media that they don't want to take medicine. So what is your approach to that part?
So once we have proven that the patient has hypertension based on multiple readings taken on different occasions, we know that the patient needs treatment. Now treatment does not only mean pharmacological treatment or medications. There is something called non-pharmacological approach. So if we feel that the patient doesn't have any other risk factor, if the patient is diabetic, has very high cholesterol, has had a history of heart attack or some very strong family history of heart disease, then of course I would like to put the patient on medications also. But if the patient is fairly young, doesn't have many of the other risk factors, and blood pressure is not very high, so as to be called as a hypertensive urgency or emergency, that is the नीचे का जो blood pressure है, if it is not crossing 110, 120, not crossing 100, then we are in this fairly safe range where we can give some time to the patient to try non-pharmacological measures, which would include lifestyle modification. Weight loss is one of the major things in that. It has been observed that if people who lose weight, their blood pressure drops by about 3 to 4 millimeters of mercury. Exercise is something that the patients can start. Aerobic exercise as well as weight training. Both these have got an effect on blood pressure. That is, the patient would drop their blood pressure. Patients would drop their blood pressure. Even if they don't lose their weight, with exercise the blood pressure comes down. Third is the important role of diet. That is, of course, as far as weight loss is concerned, that type of diet plus sodium restriction in the diet. Previously, it was said that patients who have high blood pressure should take a very low salt diet. Now, we don't advocate really low salt diet. We say that jitna आपके सब्जी में दाल में जितना salt है, you can have that. But avoid added salt. That is, don't take too much salt on salad, on fruits. Avoid chips, which are things which are very salty,
Achar.
pickles, etc.
Achar,
papad.
Papad. These are the ones which are very, very salty.
Very, very salty.
Because to tell somebody to have bland food without salt for the rest of his life, it is not feasible, right? अच्छा. So इसमें मैं एक क्वेश्चन देना चाहता हूँ कि पेशेंट को अगर हम ये बोलते हैं कि आप ये सब चीज ट्राई करिए, तो patient normally what I find is they use it as an excuse to not to have medicine. So my advice with all my years of experience, I give them a timetable. I mean, I said, okay, you got 2 months, 3 months, and it is not, we are not trying to put you under stress or an exam. But let's decide on the time in which if you can modify, because it's very easy to say modify your life. If somebody's got a job which requires staring at the computer and by the end of the day, he's totally stressed out, it is not easy for that person to change his job. So it's very easy for us to profess कि change your lifestyle totally. But the best you can do is yes, bring in some activity. इसमें भी मैं caution देता हूँ patient को कि आज मैंने आपको बोला तो आज जाके जिम जाके burn नहीं करना है, because that can be counterproductive. Because during weight training and all, the BP can go very high. So the thing is to do gradually increasing exercises, which should be more of aerobic exercises, जिसको कार्डियो बोलते हैं आजकल की लैंग्वेज में. तो मैं उनको बोलता हूँ थोड़ा चलिए, साइकिल चलाइए, ऐसा चीज करिए, and as your BP is better, then yes, you can get on to weight training also. So this is my normal message, but I like to give a timetable to the patients. What is your role on that?
Yes, जब हम एक्सरसाइज करने को भी बोलते हैं इन पेशेंट्स को, I always try to keep them, tell them to just keep a brisk walk initially, not intense exercise.
Right.
I would do a TMT for him, a treadmill test,
Correct.
and then ask him to do a more intense activity.
Absolutely right. So brisk walk, using your common sense, and as in case you're not able to do it, you're panting, don't have to prove a point. This is not military training.
Yes.
But start exercising.
Please, I get a stress test done, and then ask him to join the gym.
Yes, and stress test also, somebody is not used to activity. There's no point in getting on the stress test because he's not able to do it. Right?
It is very important he completes the test.
Okay. So let's say a patient, we have tried a non-pharmacological means as we call, that is, of course, and there is role for yoga and there is role for meditation.
Yes.
But I think the very important thing is if they're smokers, you should tell them to stop smoking.
Yes.
If they're drinking alcohol, which is
Binging.
again
Binging
binging
is
on alcohol, that also, these are the things which we can easily do.
Yes.
Little bit of walking,
Yes.
watching your diet to reduce your weight, definitely cessation of smoking, no condemnation for smoking like, sir, I'll have only 1 or 2 cigarettes. No, that as a doctor,
Not a
I'm
single
very
smoke is
particular.
advisable.
Zero means zero for that, right?
Alcohol sometimes is okay in very small quantities.
But then also one has to be able to interview the patient to say, well, what is small quantity?
Yes.
He or she understands that it is genuinely small quantity.
Yes.
And some people, they say that, or their partners will tell you that when he drinks, then he drinks a lot.
Yes.
So that's called binging. So if those who can't control the intake, I said, please stop.
Stop it completely.
Absolutely, you stop. So let's say we start the medicines on a patient, Dr. Sarita. तो पहला प्रश्न आता है पेशेंट से, सर मेरे को दवाई लूंगा तो क्या लाइफ टाइम मेरे को दवाई लेनी पड़ेगी? ये बहुत relevant question है. तो there are a lot of ज्ञान on the media on this कि एक बारी लोगे तो addicting medicine है. तो I want you to highlight the word addiction, whether it is addicting or not addicting.
So basically, when we take the decision of starting the BP medications, we have adequately ensured that the patient really has hypertension, because we are not starting it based on a single reading. We are starting it based on either multiple readings or something called ambulatory blood pressure monitoring, where a BP machine is attached to the patient for 24 hours and the patient is monitored during the day as well as night for pressure readings. So usually the medications are required long term once we decide to start.
That is what you have to highlight, is because of the nature of the disease,
Yes,
and not
it is
because
not-
we have started the medicine.
Yes, not because we've started the medicine, but because the disease is such that it will not just completely get reversed. Many times there is family history, which is important in hypertension. So all those things we cannot completely reverse just based on lifestyle.
So normally when looking at the patient, especially somebody is obese, zero activity, BP is a little high, I tell them, yes, there is a chance, but till you can reduce your weight, etc., please start taking the medicine, right? And this is not true that if you start taking medicine, you are addicted to it. So you are not able to shed your weight, like so you need to lose 20 kilos. It's not going to happen in a month or 2 months. It's going to happen over a year and a half. So while you're doing it, please take the medicine. That is my this thing, and there is a good chance. If you always a chance, it can never be 100%.
So I feel that younger the patient, there is more chance to get off that medicine. Older the patient, so less chances of getting off the medicines.
Madam highlighted family history. So, what is your take on family history, maternal and paternal? Which one is more contributory?
I think paternal is more relevant in this.
Okay, so some studies which have shown that the maternal ones, those whose mothers have got high blood pressure,
Yes.
the chances of you having, of the offspring having, is more as compared to the father. But like I said, these are no mathematical models. You can.
What I feel, not only the hypertension history, but onset of hypertension in family is more important.
Okay.
So father having a hypertension at 30, so it is a more risk of son getting a hypertension.
So that's because it's like a primary hypertension,
Yes.
which we know has got is multifactorial, but is no mathematical model.
Yes.
कि अगर father को है या mother को है,
लेकिन उनको अगर जल्दी हो गया तो possibility इनको भी जल्दी होगा.
the possibility of increases, but it's not like 100%.
Yeah,
And both parents having a possibility of being hypertension is even more.
More, correct.
Right?
Yes.
Okay. Then, how much, okay, how often, now the person has got a blood pressure, you have told him you got hypertension, is the ideal patient, he accepts, you have done all the tests. The tests, I'll again repeat, were 2, 1, to see for target organ damage, to rule out secondary hypertension, and 3 is to see the other associated issues, which which are synergistically bring the patient down, like cholesterol and diabetes, etc. So now you have the ideal patient, he accepts that and he starts taking the medicine. How often would you like to have which tests in the long-term follow-up? Because this is going to be mostly with him or her for life. So how often would you like to do which tests?
So clinically, we would like to follow up the patient at least once in 3 months to make sure that the BP is under control. As far as tests are concerned, if all the baseline tests are normal, including the creatinine and all which we do for kidney dysfunction, I feel once in a year if we can do cholesterol, creatinine and ECG, these basic things, that should be sufficient. If patient has any signals telling us that there is some kind of end organ damage which is occurring, then we would like to repeat them more frequently, maybe in 3 to 6 months. Otherwise, once in a year is more than
So
enough.
once in a year, yes, but then I tell you the problem with that is that what you're saying is academically correct, and seeing a patient once in 3 months also academically correct. But the practical issue is these are chronic diseases, right? And when you leave the patient and he's not seeing the doctor, the patient, it's human tendency to slip back into your happy ways. So a visit to a doctor a little more frequently, not necessarily you. I tell you don't have to come back to me, but आप at least BP के लिए एक महीने में एक डॉक्टर को जरूर मिलिए. One doctor a month. उससे क्या बात ज़हन में रहती है. And we don't get rude surprises. Other tendency is patient will keep taking the same medicine for 2-3 years without checking the blood, because they are in some sort of a denial. Okay, I'm all right now. Doctors give medicine, I'm taking the medicine. So nothing is wrong with me. And suddenly you get a root shock one day when there's an event, or if the test is finally done for something else and you find that the creatinine is deranged, or the lipids have gone haywire. So
the
that
blood
is
pressure
important.
is not controlled.
Or the blood pressure is not controlled because my patient feels that my blood pressure is there.
Yes.
And Dr. Khese, I'd like you to, for our audience, please highlight that there is no such thing as strong and नॉर्मल मेडिसिन और ये बहुत ज्यादा डोज है, ये बहुत कम डोज है. हाँ, तो ये थोड़ा हाईलाइट करिए क्योंकि पेशेंट हमारे घबरा जाते हैं कभी कभी, बोलते हैं कि सर अब मेरे को तो आप 3 दवाई दे रहे हो और मेरा इतना डोज क्यों है, मेरे अंकल तो 40 mg देते हैं और आप मेरे को 80 mg दे रहे हो. सो प्लीज हाईलाइट दैट कि हाउ इट इज.
जो ब्लड प्रेशर की दवाइयाँ है ये 5 मिलीग्राम, 1 मिलीग्राम, 40, 80 ऐसे अलग अलग डोजेज में आते हैं. तो ऐसा जरूरी नहीं है कि 40 वाला कम पावर का है.
If I may interfere, it is not like you cannot compare apples and mangoes,
Yes,
or mangoes or bananas. Mangoes come in kilo
Yes.
and bananas you buy in
ऐसी
dozen.
भी है जो 5 मिलीग्राम की है लेकिन ज्यादा 40 से ज्यादा असर करती है.
हाँ.
सो जरूरी है कि जो मेडिसिन है वो राइट चॉइस ऑफ मेडिसिन हैज टू बी गिवन टू राइट पर्सन.
And that I think should be left to the doctor. It's beyond
Correct.
the purview of this discussion as to
Correct.
which medicine to choose.
Yes.
And ultimately the patient has to know that his blood pressure is controlled with it or not.
Yes.
तो अगर
Yes.
आपका 5 मिलीग्राम से कंट्रोल नहीं हो रहा और डॉक्टर ने उसको 5 मिलीग्राम दिन में 2 बार बढ़ा दिया, फिर उसके बाद कोई और मेडिसिन ऐड कर दिया, आई थिंक इट्स क्वाइट ऑल राइट.
Yes.
So please leave it to your doctor. The doctors are knowing what they're doing.
Yes.
And I of course joke with my patient, look, I don't have any shares in the pharma companies, or I don't own that I have to, increase the sale of the company to, for any ulterior motive. If you need the medicine, you need the medicine.
Yes.
Right?
Yes.
Okay. Anything you like to highlight or ask?
How frequently would you like to monitor your patients with blood pressure?
So at least once in 3 months I would monitor because it is or else I tell patients even if they are late for follow up, at least they should monitor on their self.
ये सेल्फ वाला ना एक थोड़ा प्रॉब्लम है इसमें. एक होता है व्हाट आई अंडरस्टैंड विद माय एक्सपीरियंस इज अ लॉट ऑफ पेशेंट बिकम ऑब्सेसिव with the machine, and you'll find that they're taking their blood pressure 3 or 4 times in a day, and the obsession is to I must get a normal report, and that works counterproductive because the stress levels go up and it is something like a white coat hypertension in their own home. So इससे भी थोड़ा बच के रहना है. So I tell patients, once your BP is okay, see a doctor once in a month. Or as a cardiologist, you're probably seeing somebody who's stable once in 3 months.
Yes.
And please see your blood pressure then. Anything you like to ask us, Dr.
I'd like
Khese?
to tell ma'am how do you how to take a actual blood pressure at home to a patient. What is the actual procedure of the taking pressure at home? Is it कोई कहता है कि सो के लेना है, कोई कहता है बैठ के लेना है. So what is the actual method of taking blood pressure?
So, at home we have these electronic machines which are available. Multiple companies have these machines. The ideal setting is that the patient should be rested. He should not be in a rush, and you can take it either in sitting position or in lying down position. But you can take it. There is a specific way of attaching the cuff. On the electronic machines also the whole guidelines are given. The tubing should be at a particular level. The cuff should not be too tight. It should not be too loose. You should be able to put in one finger through the cuff once you have tied it. And also there is something about cuff size. There are some patients who are very obese. So if we use a normal size, regular size cuff for these patients, we will tend to overestimate the blood pressure. So there are special cuffs available for obese patients, and those cuffs should be used. Otherwise, every time their blood pressure will come extremely high.
Keep the machine at the level of the heart.
Yes.
That helps.
Sir, Mike.
Keep the machine at the level of the heart. Either if he's sitting on the table.
What is your take on the smart devices most of our patients are wearing these days?
Smart devices, wearable devices are. I
No,
don't
when they're
feel.
using a watch or something. So they're saying
for
my
blood-
watch is showing this much.
Blood pressure, what I have seen people measuring blood pressure to a wearable device is not that accurate as compared to a digital monitor, a larger digital monitor which is available.
So I would say, okay, the device that you're wearing may be a pointer, but then you have to cross-check with the proper device.
Yeah.
Okay, now we have a whole lot of questions because we're coming to the end of this session.
Yes.
So I'll just read them out and we'll try and answer this thing. So the first question is primary risk factor for developing hypertension in young individual.
तो मोस्ट इम्पोर्टेंट मॉडिफाइबल रहते हैं, कुछ नॉन मॉडिफाइबल रहते हैं. मॉडिफाइबल मतलब जिसको हम चेंज कर सकते हैं, जैसे कि हो गया स्मोकिंग, सिडेंट्री लाइफस्टाइल जो पूरा दिन बैठ के है, कोई फिजिकल एक्टिविटी नहीं है. नॉन मॉडिफाइबल होता है जो फैमिली हिस्ट्री है जिसको. तो these are the main reasons of and associated factors like
Okay,
diabetes.
so if I sum it up, so primary risk factors, there are some which you cannot modify.
Yes.
That is like your genetic structure which you have
Yes.
inherited.
Yes.
But what we can modify
Yes.
is your one active lifestyle. That means that you have some physical activity, not some, depending on your age. I
Yes.
mean, if the person is in the 20s, well, should be going for a jog at least 3 or 4 days in a week.
At least
You know,
5
we're
days a
talking
week.
about prevention right now, right? So activity is one, and obesity is separate. Also, the two are linked.
Yes.
But even if you are not shedding the weight, but you are doing some activity, that helps, as what she says. Similarly, even if your activity is not increasing, but with dietary control, you are shedding your weight, that also will help. But ideally, both. You should be exercising and having a correct diet, so your body mass index, etc., is fine.
Yes.
And definitely, the biggest no is cigarettes.
Yes.
And cigarettes is not just the cigarette which we buy at the panwala shop, and of course in the panwala shop also is the next thing, that is vaping, which seems to be the fashion now. It is just as bad, if not worse, because you're just inhaling pure nicotine.
Yes.
So right now it is relatively new, so much of data is not there. So I cannot give any scientific conclusion as to this, but it is nicotine, your pure nicotine, and it is more addicting than the cigarettes, is what my personal experience is. So please stay away from the vapes. Okay. Now, lifestyle changes to prevent hypertension is the next question, but I think we just covered that, right? So, how do medications work? Now, this actually will go back to second MBBS in a pharmacology exam. Are there any side effects? I think I'll try and answer the first half. See, different medicines work differently. Like some are working at the level of the blood vessel, some are working at the level of the kidney. But we leave that alone, it's too academic. But are there any side effects? Now, this is a question I'm always faced with, but for anything. But if you look at the literature or net and you search for side effects, even water has got side effects, right? So, theoretically, every substance that you chew in, which you take inside you, will have some side effects. But always it is a balance of effect and side effects. So my mashwara to the patients is कि आप सिर्फ साइड इफेक्ट मत देखो, इफेक्ट देखो पहले, फिर उसके बाद साइड इफेक्ट की बात करेंगे और दोनों चीज का बैलेंस करेंगे. And your doctor, if you're going regularly, will be able to identify if something is going wrong in your case with the medicines. But to say, are there any side effects? I can't say yes and I can't say no. I think to be used with discretion, I think practically it's quite easy. And now the data is in millions of patient years.
Yes.
Because the medicines have been around for decades, means half a century.
Yes.
And there's so many people taking over. So it's not like an odd sample size is not very small. So if the medicine is designated as safe, I think it's quite safe.
Yes, and nowadays molecules, जो drugs है, they are getting better and better.
They're getting better and better. Yeah.
Lower side effects
Yeah.
are there.
Okay. What tests are conducted to assess and monitor blood pressure? I think we covered that earlier in a talk, so maybe you missed out. The person was asking the question, but I think this talk will be available.
Yes.
So we have discussed that in detail.
24
So
hour
you will get your answers.
24-hour ambulatory BP होता है जो 24 घंटे BP चेक करता है.
That also, everybody need not do that.
Need
That
not
is
do
only
that.
when you have suspected white coat hypertension.
Yes.
Or episodic hypertension.
Yes.
Like when patient gives some feeling, ki, sir, I had the sweating bout and this thing and my BP was high, and then so like pheochromocytoma, etc. So then it is important to do that. But otherwise, for a regular person, no.
Yes.
You know, it gets confusing. It's not easily available.
Yes.
Yes, it's difficult. Like even in a hospital, how many machines there are? 1 or 2, and there will be a waiting list for it, right?
Yes.
Okay. Okay, how does family history influence of developing hypertension? We covered that earlier, but I'll again say that. Family history makes you more vulnerable to having primary hypertension. And my understanding is from the mother's side, at least for diabetes, it is so even. And if both your parents have it, more chances of you getting it. But it does not mean 100%. So patients who got family history, it doesn't mean that you will necessarily get the blood pressure. And those who don't have family history, it does not mean that you will not get blood pressure. which is the chances,
Both-
the
both
probability
ways.
changes,
Both ways
right?
it is possible.
So, and there is no mathematical model in this. Like you have a black and white, so you'll get a gray in between. It is no mathematical model. How does one know that they have developed hypertension? I think we tackle this again. Tell.
Yes. So ब्लड प्रेशर जैसे हमने डिस्कस किया कि मोस्ट ऑफ द टाइम कोई सिम्टम नहीं होता है,
Yes, so-
इंसिडेंटल होता है,
So we just find the doctor finds it for you.
डॉक्टर फाइंड्स फॉर इट.
Okay, but how does the patient, like 4-5% of patients who have some symptoms, what are the symptoms they will come
Symptoms
with?
are also very vague.
Yeah.
Around 5-10% patients that get symptoms are headache.
Headache or
Very-
heaviness of head
heaviness
more
of
than
head.
the headache.
Yes.
They say I feel heavy
Chest-
in the head.
हाँ, chest heaviness, दम लगता है, someone may have syncope, चक्कर आके गिर जाता है, some may have just dizziness.
But I think of all that you listed, those are really those far advanced things,
Yes.
like having a
some breathlessness on exertion.
Yes, that
Heavy
probably
exertion.
shows that there's something more than that.
No, more than
But I think the commonest symptom, if any, is like a heaviness in the head
Head, yes.
and a headache sometimes. Yeah. Sometimes visual blurring also, dizziness.
Episodic blurring some may get.
Dizziness also
Dizziness.
sometimes you get, yeah. But again the message, I'm repeating it again, most people will not have any symptoms till they have a catastrophic event. Okay. Okay, this is a nice question, maybe you'll take it. So, how does hypertension during pregnancy affect mother or the baby?
Hypertension during pregnancy is a totally different topic. It is not essentially related to essential hypertension that we have discussed. So there are certain hormones or there are certain chemicals during pregnancy which can increase the chances of getting high blood pressure. There are different risk factors. They can occur more commonly in elderly patients who become pregnant for the first time. If patient has a pregnancy after the age of say 30-35, increased chances in twin pregnancy
this
also.
person's question is, how does hypertension during pregnancy affect mother or the baby?
Yeah, so it can affect the mother. Sometimes if the pressure is uncontrolled, there is a condition called eclampsia in which the mother can get even fits, can become unconscious. There can be a lot of swelling of legs. There can be increased chances of breathlessness. And for the baby, initially because of high blood pressure, there is something called intrauterine growth retardation. That is, the baby's size may be low, smaller for the gestational age. And there are chances of preterm delivery and other complications related to, even there can be visual blurring and other complications in the mother. So during pregnancy, it's all the more essential to continuously monitor the blood pressure. And if you have pregnancy-induced hypertension, then to take appropriate drugs and be under constant supervision of the gynecologist as well as the physician.
No, very nicely brought out. So, blood pressure in pregnancy is a subject by itself. So there are some ladies when they are expecting, their blood pressure goes up only during that. So which is called what we used to call earlier pregnancy-induced hypertension. That term is not used anymore now.
Gestational
Now it is
hypertension.
called gestational hypertension. And remember, this may not be necessarily the pregnancy is the stress in the body. So somebody who's got a strong family history, until now the blood pressure was not visible. Now, during this time, the blood pressure may come on. But irrespective, whatever be the cause, whether the gestational hypertension, whether it is because of the pregnancy or the pregnancy is bringing out something which is there in the genetics, the blood pressure have to be controlled for the safety of the mother and for preventing fetal growth retardation. And the drugs are again limited here because all the drugs which we use for non-pregnant patients are not necessarily approved for use in pregnancy. And number two, the gynecologist, their criteria for control is much stricter as compared to like what we would do in a non-pregnant person.
And some of the patients post-delivery may continue to have high blood pressure. Few
Yes,
maybe
so sometimes with the delivery, the blood pressure ends,
vanishes,
and sometimes it doesn't, so the medication has to be continued. Now, even for the ladies who after pregnancy the blood pressure normalizes, as they grow later in life, they have to watch out for the onset of primary hypertension. The chances of getting a full-fledged blood pressure of the adults is more if there is a history of blood pressure during the pregnancy.
10% patients can carry hypertension from gestation.
True. So even if you have the hiatus in between, at honeymoon period, like after the baby is born, there is no blood pressure. So one should not get complacent with that. So you have to watch all the things which we discussed earlier: weight, activity, no smoking, etc. Because if you had a little high pressure during the pregnancy, your chances of getting it back again sometime in life is much more. So I think very nice discussion. Thank you both for being here. And with this we sign off. Thank you.
Thank you.